Please be aware that this video is intended as an educational resource only and should not be used as personal medical advice. All decisions about the management of your health or condition should be made in conjunction with your specialist or medical professional. So, what is a hip replacement? A hip replacement is a common type of surgery where a damaged hip joint is replaced with an artificial joint known as the prosthesis. A prosthesis is an artificial body part which replaces a damaged or missing part of your body. New materials and technology will in most cases allow you to have a normal and active life. During your consult, your surgeon will advise you on which is the most appropriate prosthesis for your age, lifestyle and bone quality. To better understand your hip replacement procedure, we should take a few moments to learn a little about your hip anatomy, the procedure, and the risks and issues involved. So let's start with the anatomy of your hip. Your hip is where your thigh bone or femur meets the pelvis. It's a ball and socket joint. The ball is on top of the femur or thigh bone, and the cup-shaped socket on the pelvis is called the acetabulum. Both surfaces of the joint are covered by a smooth, slippery surface of articular cartilage that allows free movement. This articular cartilage cushions the joint and allows smooth hip movements. Articular cartilage is not visible on X-rays, therefore you normally see a joint space between the top of the femur and the acetabular socket in your hip. Your hip is part of the pelvis, a bowl-like collection of bones, with each side of your pelvis actually being made up of three bones: the ilium, the ischium, and the pubis. The acetabulum is the socket in your pelvis, joining the top of the thigh bone or femur to the pelvis, thus creating the hip joint. The femur, the thigh bone or femur, is the longest bone in your body. It connects the pelvis via the acetabular socket to form the hip joint. The upper part of the femur is composed of the femoral head, the febrile neck, and the greater and lesser trochanter. So, why might you need a hip replacement? A hip replacement is required when your pain or mobility is so bad that it actually interferes with the things that you want or need to do. The most common reason for hip replacement is osteoarthritis. Osteoarthritis causes wear and tear that over the years destroys the smooth articular cartilage. This causes bones of the joint to rub together, and growths on the bones called spurs may also form around the joint, adding to the pain and stiffness. Other common reasons include rheumatoid arthritis, a condition where the body's immune system attacks the membrane that lines the joint. Post-traumatic arthritis, a form of osteoarthritis that occurs after injury, such as a fracture or ligament tear. Post-traumatic arthritis can also cause inflammation or affect the alignment of your hip, leading to cartilage damage over time. Often, these injuries are suffered earlier in life and will cause you to have arthritis in middle age or later years. And lastly, of course, an actual injury to the hip joint caused by accident or fall. It's comforting to know that hip replacements normally relieve pain and increase mobility in about 90% of people who undergo a hip replacement procedure. We begin with your diagnosis. Firstly, an orthopedic surgeon will examine and evaluate your hip symptoms to ensure a proper diagnosis in order to provide the best treatment outcome. Your orthopedic surgeon will discuss and record your medical history, perform a physical examination, request diagnostic studies such as X-rays or MRI. An MRI is magnetic resonance imaging, where magnetic and radio waves are used to create a more detailed computer image of soft tissue, nerves and ligaments. Your orthopedic surgeon could also suggest more conservative treatment options such as prescribing anti-inflammatory medications, referring you for physiotherapy, suggesting rest, suggesting you limit certain activities, or an injection of steroids and analgesics directly into the hip joint. Your surgery will be performed in a hospital operating room under general, spinal, or epidural anesthetic, depending on you and your surgeon's wishes. During your surgery, your surgeon will remove the damaged sections of your hip joint and replace them with parts typically constructed of metal and very hard plastics. This artificial joint or prosthesis will help reduce pain and improve function, and your surgery will typically include the following steps. Firstly, your surgeon will make an incision to the hip to access the joint. The size and type of incision will vary with age, sex, size, and the type of implant. After dislocating the femur from the socket, the head of the femur is removed, and the acebellum or cup socket is reshaped to match the shape of your new cup implant. The cup implant is positioned and locked into place with screws or bone cement, depending on your bone quality, to fully secure the implant. Then a hollow within your femur or thigh bone is enlarged so that the implant stem can fit correctly. Then a temporary ball is placed on top of the stem so that your hip joint can be tested for a range of motion and stability to make sure the prosthesis doesn't dislocate from the hip socket. Then your permanent prosthesis is secured to the stem and the hip joint is retested for mobility and stability. Lastly, your doctor will ensure that your leg lengths are the same as before closing up the incision with stitches. Recovery from hip replacement surgery can take several weeks, depending on your health and age. Your physical therapist will assist you in regaining a full range of motion. However, you can expect a walker or cane to be necessary until the joint strengthens. Typically, you can return to light work and activities after about 6 weeks. And your hip implant is expected to last from 10 to 20 years and will naturally wear with age. After surgery, your surgeon will provide you with a post-operative course of action to aid your recovery. This will depend upon the type of surgery performed. Your post-operative plan may include specific instructions regarding your lifestyle, activity or rehabilitation, prescription medications to keep you comfortable at home, instructions about wound care and bathing. Typically, you may shower once the dressings are removed unless otherwise directed by your surgeon, and physiotherapy if required to restore normal function and strength. As with any surgery, there are always potential risks. Your decision to proceed with the surgery is made because the advantages of the surgery outweigh the potential disadvantages. It is important that you are informed of these risks before the surgery takes place. Complications can be medical, general, or specific to the surgery. Medical complications include those of the anesthetic and your general well-being. Potential complications. It should be noted that the vast majority of patients suffer no complications. However, complications can occur with any surgery and may include allergic reactions to medications, blood loss requiring transfusion with a low risk of disease transmission, heart attack, strokes, kidney failure, pneumonia, and bladder infections. Complications from the use of nerve blockers, such as infection or nerve damage, serious ongoing medical problems or concerns, leading to prolonged hospitalization or very rarely death. Infections. Infections at the incision site, or a more serious infection within the joint space of the hip. Nerve damage, tingling, pain, and weakness from nerve damage or nerve trauma. This may be temporary or permanent and can cause numbness. Hemarthrosis, excess bleeding into the joint or surgery site. This may require additional arthroscopic surgery to irrigate the joint and evacuate or drain the blood. Blood clots or deep vein thrombosis. These typically form in the calf muscles and can travel to the lung, causing a pulmonary embolism. These can occasionally be serious or even life-threatening. If at any stage you get calf pain or shortness of breath, you should notify your surgeon immediately. The failure to relieve pain. This is rare but may occur, especially if pain is coming from other areas, such as the spine. There are risk factors that can negatively affect your healing after surgery, including general ill health, poor nutrition, smoking, obesity, diabetes, age, over 60, alcoholism, chronic illness, and steroid use. Weighing this all up and having a good understanding of the procedure is important. If you have any doubts, questions or queries, please consult your specialist or medical professional.